bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Who gets it, what causes it, and how do you get rid of it? We're talking today about rosacea on Comcast Newsmakers. I'm Janelle Wolf, and I'm joined today by Dr. Harriet Comite. She's a fellow with the American Academy of Dermatology, board certified, and we appreciate you being here again, Doctor.
Thank you.
Let's talk a little bit about this skin condition, which I think many people associate with red blotchiness on the face.
Yes, that's correct. That's called rosacea, and it runs in families. It's genetic. We're not quite sure what causes it, but some of us think it might be because blood vessels expand too easily, but there are environmental factors which can trigger it as well.
We have a picture of exactly what it looks like, a before and after, so you can get an idea. Basically, some people might see it as a blushing on the cheeks, but it can really be on any part of the face, the nose, the chin, wherever.
Correct. It can also be on the neck as well as the chest.
Very noticeable difference between the before and after. What kind of treatment do you use to get rid of something like this? And is it an annual upkeep, a monthly thing, or a skin cream that you have to constantly put on to keep it at bay?
That's excellent questions. You can't really get rid of rosacea. There's no cure for it, unfortunately, but there are many, many ways of controlling it and actually even reversing rosacea. And in my practice, we use cosmeceuticals such as green tea, antioxidants, vitamin A's. We also sometimes use antibiotics, both topical and oral, but an excellent choice for rosacea to actually reverse the condition back to a previous time would be lasers. A vascular laser will help get rid of the redness, and a smooth beam laser will reverse the oiliness and the pimples that are associated with rosacea.
Now, I am totally hooked on going to a dermatologist. It's the best thing I could have done to my skin, thanks to you. But could you tell me about those people that are out there, and I know they're still out there, that say you're doing damage to your skin by doing things preventatively as a younger person, because they're convinced that as I get older, I'm suddenly going to do more harm than good by doing this now.
Actually, the more you do in prevention, especially for rosacea, which is a disease, the less active it will be and the nicer your skin will look. So one of the things you want to do is start preventing and calming rosacea down from the beginning. You want to use products to calm it down. People associate rosacea with alcoholics, and one of the reasons, alcohol absolutely does not cause rosacea. It may trigger rosacea, such as a glass of red wine, but it doesn't cause rosacea. But alcoholics generally don't take care of their skin, and they don't see a doctor, so their rosacea becomes more and more active. And a good example of that is W.C. Fields, who had that large rhinophyma, which is a bulbous, thick nose.
And that's not rosacea,
that
or is it?
That is rosacea.
Okay.
Generally, we see rosacea more often in women than men. Usually, it starts in the 30s. But when men get it, it can be much more severe. And the nose is called a rhinophyma, and that's oversized growing oil glands. These days, by treating early and preventing that, you can avoid surgery, which you might need when you have that nose develop.
Psychologically, this has to do something to you, too, where it's very similar, I guess, to a younger person that might have acne, where you go out and you feel embarrassed and you feel insecure because of the way your face looks.
Correct. A lot of people avoid social situations. They don't want to go to parties. They avoid public speaking because they flush so red. And if you don't feel like you look your best, which you don't, if your face is bright red or your neck or chest, you want to avoid those situations.
All right, Dr. Comite, we're almost out of time, but what final thoughts do you want to leave with our viewers who might be thinking about getting the treatment or even lasers and they're a little skeptical?
Probably the best advice I can say is see a dermatologist when it starts, keep it under control, and if it progresses, you may need more treatments to actively control it and reverse it, and your skin will continue to look beautiful as you age.
We're hearing so much about those mineral makeups that are out there. Is that enough to cover it
cosmetically? In some cases, it is to cover the red and the flushing, but it would be it's nice for people not to have to wear makeup to cover their skin, and your skin should be your best cosmetic and not only use makeup for that.
All right. Thank you for joining us.
Thank you.
And I'm Janelle Wolf. You've been watching Comcast Newsmakers with Dr. Harriet Comite. For more news and information, visit us online at cn8.tv.